Good afternoon, everyone. I'm Mary Deacon, Chair of Bell Let's Talk. I am very pleased to welcome you to this important conversation about mental health and well-being in Black, Indigenous, and people of color communities. Now, as we all know, the pandemic has affected every aspect of our lives, including our mental health, and has even further highlighted the challenges and inequities faced by those who experience racial injustice. The tragic deaths of George Floyd and Joyce Echaquan put an even brighter spotlight on systemic racism and the significant impacts racism and inequity have on the mental health and well-being of diverse communities. As individuals and as a society, we must do better to understand the issues, to examine our own attitudes, beliefs, and behaviors, to take concrete steps to tackle systemic racism, and to be allies in helping ensure that culturally informed mental health services are readily available. On Wednesday, Bell Let's Talk announced the latest grant recipients for the Bell Let's Talk Diversity Fund that supports the mental health and well-being of BIPOC communities in Canada. And today we've gathered community leaders, people with lived experience, and some of the best experts in the field of mental health to have a conversation about the current state of mental health in BIPOC communities, all as part of Bell's commitment to take meaningful action to address the impacts of systemic racism and institutional bias. I want to thank Queen's University for organizing this important Bell Let's Talk event. And I'd like to thank all of you for attending today. And now I have a call to action for all of you. January 28th is Bell Let's Talk Day. I hope everyone joins in to build awareness, acceptance, and action in mental health and drive Bell donations. And where does that money go? It goes to organizations, large and small, coast to coast to coast, like the recipients of the Bell Let's Talk Diversity Fund announced earlier this week. It is now indeed my great pleasure to introduce today's moderator, Dr. Jane Philpott, Dean of the Faculty of Health Sciences and Director of the School of Medicine at Queen's University, and a former federal minister of both health and Indigenous services. Thank you, Jane, and over to you.
Thank you very much, Mary. It is my delight to be the moderator of today's event, and I thank Mary Deacon and the entire team at Bell Let's Talk for their vision in creating this event, and it is an honor for Queen's University to co-host this important discussion today. So before we begin, I want to situate myself. I am today in the city of Kingston, Ontario, not too far from the shores of beautiful Lake Ontario. And I want to start by acknowledging that Queen's University and its beautiful campus is situated on territory that has been the traditional territory of Anishinaabe peoples, Haudenosaunee peoples, Huron-Wendat, and others. And I am thankful for those who have cared for this land for millennia. I am a descendant of settlers, and I am a newcomer to this region, and I am grateful to be able to live and learn in this beautiful place. So with that, I want to welcome you to this event where we're talking about mental wellness, and particularly mental wellness in the context of people with racialized perspectives, and particularly Black, Indigenous, and people of color communities. We're going to have 4 fantastic panelists who are experts in this area and who are going to be able to help us deal with some of the very great challenges. And so I'll briefly introduce them to you now, and then I'm going to let them each tell you a bit about themselves. So our first speaker that you'll see is Dr. Myrna Lashley. She's an assistant professor in the Department of Psychiatry at McGill University. We're also joined by Dr. Kenneth Fung, who's a psychiatrist and clinical director of the Asian Initiative in Mental Health program at the University Health Network in Toronto, where he's an associate professor with Equity, Gender, and Populations Division of Psychiatry. I'm also delighted to welcome President Nathan Obed, who is the president of the Inuit Tapiriit Kanatami. And finally, we're very honored to have with us Asante Houghton, who is a well-known public speaker and human rights activist who focuses his work on looking at mental health through the prism of racism. Welcome to all four of you. I'm very pleased to be able to share this moment with you. And I think we will turn to each of our special guests and ask you to say a few words about yourself. So perhaps I'll go to Dr. Lashley first.
Good morning to everyone. Thank you very much for the invitation. Nice to be here. I am Myrna Lashley. I was born in Barbados, so I am an immigrant to this country. I work at the Jewish General Hospital. My primary area is in the well-being of Black people, specifically youth. And I work at the intersection of race, radicalization, and equity. And I thank you very much for having me.
Thanks for being here, Dr. Lashley. I'll turn next to Dr. Kenneth Fung and ask him to put on his camera and tell us a bit about himself.
Hi, everyone. Good morning or good afternoon, everyone. And thank you so much for being here. And thank you so much for organizing this forum. My name is Kenneth Fung, and I'm a psychiatrist. And since Myrna has started introducing her roots, I would also say that I am a 1.5 generation Chinese Canadian. We're into fractions. We're Chinese, so we're math oriented. So 1.5 generation means that I have immigrated here when I was like 13 or something like that. And my passion is in the area of culture and mental health, as well as psychological intervention, psychotherapy. And I'm very interested in both clinical care, education, as well as community-based research on empowering communities to champion for social justice. I have a particular interest in immigrant health and Asian mental health and stigma and public health promotion and all of this. And I'm also the current president for the Society for the Study of Psychiatry and Culture, because we want to promote the importance of culture and equity.
Fantastic. We're so delighted that you're here. It's my great pleasure next to introduce you to an extraordinary person whom I've had the privilege of knowing for a number of years, President Nathan Obed, and I'll ask him to provide a little bit of an introduction to himself.
Oh, thanks so much, Jane, for that introduction. And it's wonderful to be here. It's good to see Mary again, and then also some of my new friends that I'll be sharing the stage with. I'm Nathan Obed. I'm the president of Inuit Tapiriit Kanatami, as I've been introduced. I am from Nain Nunatsiavut, from one of the 4 Inuit Nunangat regions in Canada. And I've been president at ITK now for over 5 years. I have spent my entire career working on behalf of Inuit and Inuit rights. I've spent a lot of that time working in the socioeconomic field, especially in relation to health and mental wellness and suicide prevention. So this area is near and dear to my heart, and also really timely that we're able to have this conversation today. So I look forward to it.
Thank you very much, Nathan. It's wonderful that you are here with us today. And our fourth speaker, I'm just trying to spot where Asante has gone. Are you there, Asante? There you are. Wonderful. Yeah. Delighted to have Asante Houghton with us, and I'll ask you to introduce yourself to the audience.
Amazing. Thank you. I appreciate it. Welcome, everybody. I appreciate you being here. Appreciate you all having me here as well. My name is Asante Houghton, and since we're in the trend, I was born in Jamaica, raised here in Toronto, where I currently reside. I wear a lot of different hats in my 9-to-5 day job work. I'm a peer support worker. I train peer support workers, and I'm also a manager of peer support programs at an organization called Stella's Place in downtown Toronto that serves young people. Also, the training lead in a project called the Community Healing Project, which is focused on marginalized communities in Toronto, communities that are impacted by community violence, and amplifying mental health discussions in those places. Again, focusing on young people and trying to build peer-to-peer networks. Outside of that, I am the co-founder of the Reach Out Response Network. What we are is a advocacy group based in Toronto, working to bring alternative mobile crisis that is led by mental health workers to the city. And, we're feeling pretty positive about where that's going. I also host a web show called Cypher, which takes the stories and the pure support stories of folks and turns them into songs by real musical artists. I'm a 2-time TEDx speaker, and I had the distinction of being named one of CAMH's 150 mental health difference makers in Canada. So that's the resume. I don't really like doing it that much, but that's what we do with this portion of the show. So, but I'm happy to be here and look forward to the conversation.
Thanks. That's a lot of great work to be proud of. So it's great to have this time together, and we're going to try to be as organic as possible. We've received literally hundreds of questions. It looks like we've got, I don't know, close to 1,000 people tuning in already. Might be even more coming on soon. And people have been sending in questions. You can still send us your comments, and we'll try to get to as many as we possibly can and hear from each of our panelists. So in my focus in health sciences, of course, we've really been thinking a lot about mental wellness and its challenges, particularly in the context of the pandemic. So I think what I'd like to do as we sort of start things off here is there are issues about mental wellness and its links to racism, but I think that the pandemic has perhaps elevated those links in many ways. And so I'd like to hear from some of you about how the pandemic has impacted mental health in your community. How has it compounded those determinants of health that are already a serious issue for people who are racialized? Who would like to jump in on that one first? I'll maybe turn, I'll pick on Dr. Lashley to kick that one off. Oh, you're muted there.
We have to remember these things all the time. Yes, thank you very much for the question. It has decimated to some extent the Black community. Black people have tended to be on the forefront of this. Very often they're the ones working in the long-term care homes. There are a lot of Black medical professionals, a lot of Black nurses. A lot of people in some areas are living in multi-generational homes. So they're the ones that we're not collecting the data that we need to. And we need to have race-related data, race-based data to understand what's happening in the community. And we're not doing that. We need to do that. On top of that, when you're dealing with issues of the pandemic, plus you're working and people are bringing issues of racism to bear upon you, it multiplies the problem. So one never knows where it starts and where it begins, because it becomes so interrelated and so interconnected that it's difficult to decipher it. That being said, it's too much of a burden to have on this community and indeed on BIPOC communities, because we've got other people, not just Black people, who are from the immigrant population, Filipinos, for example. I'm not saying all Blacks and Filipinos are immigrants, but they're the ones who are carrying the burden. And I think we have to pay attention to that. We have to understand, we have to collect race-based data and see what we can do to help this.
Thanks very much, Dr. Lashley. I'll look to others, and specifically kind of thinking about the mental health impacts that you've seen in your community over the pandemic. I think we're still, as Dr. Lashley said, struggling with the lack of data in terms of, the extent to which suicide rates have gone up, or substance use issues causing more morbidity, et cetera. Dr. Fung, what are you seeing in communities that you're working with?
Yeah, thank you. I agree so much with what Dr. Lashley is saying. Can we kind of call you Myrna in this forum? So
We have for years, Kenny, called each other by our first name.
I know.
It feels awkward calling you Dr. Fung.
I know. So call me Ken. Yeah, or Ken or Kenneth.
Yeah.
So yeah, this is I agree so much with what Myrna is saying, that with the pandemic, it really highlights existing problems and then magnifying it like 1,000-fold. And I think that's what people are experiencing. So for the Asian community, for example, not only they've been in this pandemic longer, in the sense that, of course, before it hits North America, it was already in the news in Asia. It's hitting Asia. So families, relatives were already having that impact. And on top of that, like, I run an Asian program, and this was before there was any public spread. But even from administration, they're saying, oh, I guess your Asian mental health clinic is a high-risk contagious clinic. And I said, really? I'm seeing mental health patients in the Asian population. I'm not running a pulmonary respirology clinic. So, and there were people who are, so this is started like for us, as soon as it hits in the pandemic, it's in China, before it became global pandemic, Asian community has started to suffer mentally and psychologically from everything from worrying about what's going on there to encountering racism and stigma here. And this is really problematic, obviously. And when finally it does arrive here, this has only, of course, escalated for a lot of the Asian populations. As Myrna talked about, people are employed in sometimes precarious kind of employment. A lot of people are working in, of course, food industries or different kinds of employment where the protection is much less. So financially, it can become a huge problem. There are a lot of people are already disconnected from their immigrant, roots and families, and now they're further isolated. That can become a huge issue. People who are living in basements with many families, now suddenly everyone is around the house. Asians are probably one of the first groups to wear masks. Even Asian groups petitioning more people wear masks, and we were actually targeted for wearing masks. And of course, I think there are famous videos around that. And an Angus Reid Post survey, of course, has reflected that like 2/3 of Chinese populations in this national survey has experienced racism related to the pandemic. My own father has been told to go back to his home country just crossing the street. And my patient yesterday telling me the same thing. So everyday occurrence of people wearing a mask, but being chastised for wearing a mask. And so it's been a very difficult thing with the heightened racism that compounds on the, of course, all the social determinants that minority groups as a group, we know. I just finished presenting grand rounds just an hour ago. We look at data from the US. The first data that look at worries and mental health and different groups. So first of all the racialized population have heightened worries. And in particular, the Asian group has the highest worry threats perceived because of all this rhetoric of what's happening with the pandemic.
Well, thanks. That's helpful to have the data, but obviously disturbing to realize how challenging it is for those communities. I'm going to go to Natan next, because you've got a unique perspective, and of course the pandemic has affected Inuit in very different ways, and I'm wondering what you're seeing on its impact from a mental wellness point of view.
Yeah, thanks for the question. I think I'll start, just for everyone's sake, in saying that there are about 65,000 Inuit in Canada, and the majority of Inuit live within 51 communities across Inuit Nunangat, which is our homeland. And these are almost exclusively fly-in, fly-out communities. The only roads are to Inuvik and Tuktoyaktuk in the Western Arctic. We rely on sea lift resupply in the summer, which almost primarily comes from Montreal to get all of our non-perishable items in. And then we rely on air traffic for our healthcare, for all of our non-perishable food, and also then for a lot of other things like testing. So there are a number of different compounding mental health challenges. First, from a health perspective, we already have 300 times the rate of tuberculosis in our communities in relation to all other Canadians born in Canada. So we are very familiar with respiratory illness, and we also have an ambitious plan that Jane, you and I have started to try to eliminate tuberculosis by 2030. So we have a familiarity with this type of illness. We also know the realities that we face in our communities, such as overcrowding. 52% of our homes are overcrowded in comparison to 7% of the rest of Canadians. So a lot of the public health messaging is almost impossible to follow within our communities, and then makes people who want to do the right thing feel distressed that they just have no possible way to do it. And also in relation to healthcare, we have basically nurses in most of our communities and health centers. A lot of the care that we have for anything of serious concern happens in southern centers. So there are very real concerns about going to the south and then receiving care. There actually have been people, Inuit, who have died from having to go to southern centers to receive care, contracted COVID during that care, and then have passed away. So this is a fear that then people have around accessing basic healthcare. The same thing for education. What are people going to do who are going to university? Are they going to go to the south, or are they going to stay at home? If they stay at home, will they have the internet bandwidth to be able to take the courses that their colleagues are taking? People have had to make incredibly hard decisions about employment as well. Some people have had to move outside of Inuit Nunangat during this pandemic in order to maintain their employment at mine sites, because mines aren't interacting with communities in the same way and getting Inuit working from communities in certain jurisdictions in certain scenarios. So it has been really difficult, and we are very fortunate now that we are in a priority list for reception of the vaccine. And Moderna vaccines have been distributed now in a number of our communities, the first round. And it's great to have that connection with the federal government and provinces and territories that recognize the very huge risks that our communities face and the toll that it's exacting on our mental health.
Thank you. It's an enormous challenge, and thank you for helping us to understand that. I'm going to go to Asante next, who takes us to a very different context in the big city of Toronto. And what are you seeing in communities there in terms of the way that the pandemic has impacted people's mental wellness?
I'm seeing a lot of different things. We could probably speak for much longer than an hour about this. I think in a lot of ways, the pandemic has highlighted a lot of the systemic challenges that we face in our society today. One of those things being racism, and how racism and poverty intersect, very strongly. So the communities that I work with, by and large, are marginalized along a lot of different lines, but economics being one of them. And again, we look at race, and there it is. So what am I seeing? A lot of trickle-down impacts of our lives now being the way that they are, being virtual and very disconnected from each other. I'm seeing things like lack of access to information, about how to stay healthy during this time. People are losing access to things like the outdoors or community centers or rec centers where they might, have worked out for free or met up with, community social groups and things of that nature. People don't have good internet at home in many of the communities that I work in. So one thing that, what we've done in the community healing project is we've had to supplement folks with internet data sticks and sometimes devices and things of that nature, just so that they can log on to go to school. So there are a lot of these trickle down effects that are occurring that I think are not necessarily being spoken about or highlighted as, a consequence of marginalization is, well, what that means is we're not seeing people and their full experience and what they're going through on a day-to-day basis. You have folks who, maybe have lost jobs. Their jobs have been eliminated and, there's no CERB now and, all of these different things. So how are they surviving? You have folks who work in essential services. And I know a lot of folks who are contracting COVID and, living like Dr. Myrna Lashley was saying before in these multi-generational families and just passing it around to everybody. As we look at, geographic scan in Toronto, where we're finding COVID is most prevalent, are in the parts of the city that are low income, high immigrant, and mostly, Black, Indigenous, and people of color. So what this says, I think, is that when we look at how we are structuring our systems from top to bottom up, we are putting people in positions where they are more likely to experience poor health outcomes, mental health outcomes, and everything else because of how we have designed certain structures. It's sad that this is, between George Floyd and the pandemic, that this is how we started to, bring these issues to the forefront. But I'm glad that we're here, and hopefully this can be a jumping off point for us to start to really challenge these things that have always existed. And, people like myself and our panelists and you as well, Dr. Philpott, have been talking about these things for a very long time, but now it's time to actually do something about them. But to actually answer your question, mental health has not been great in these communities. It's been very poor, I would say. And I have friends who are really struggling right now, like really bad. I have, youth that I work with who are struggling really bad. And, my phone is just ringing off the hook all the time with messages of people needing support. And, I'm not the only one, it's just something that is kind of existing everywhere I look these days. So, now we're in a tough situation. We call this the echo pandemic, the mental health impacts that people are facing as a result of the way that our lives are now. So we have to really, I think, band together as a community, as a society, and be strategic and really look at what we can do and find creative ways to support each other.
Yeah, that's. I'm sure you're supporting a lot of people, and but as you say, it gets a bit overwhelming, the numbers of people that you've been supporting through this. Can I maybe take us a bit deeper to going back to before the pandemic? Racism has had an impact on, of course, health in general, but mental health in particular. Maybe just I'm going to go to someone like Ken first to just help us really understand that link between racism and mental wellness and what the impact is. For you, maybe from an academic perspective, but even as well from a personal perspective, what you're seeing in the impacts of racism.
Sure, thank you. I think I really want to echo what my other friends in the panel have been saying, that essentially this is not new. And as you're saying, before the pandemic, there was already racism, and there's already systemic inequities in many different ways. And so we're talking about many different structural issues and structural problems. So what that sets up is in multiple ways. It affects people's real lives every day in multiple ways. I think one is to social determinants of health that, Asante and has already really eloquently talked about, the intersection of the intersectionality of the different social cultural categories that puts us in disadvantaged and marginalized position and jeopardize access to what we call social determinants of health. What does that mean? It means that if you look at minority groups, they're always underpaid compared to mainstream groups. Employment opportunity is less, right? So all of this, housing, access to services, access to healthcare services, access to mental health care services, all of this, multiple barriers from access to resources to access to services. So I think that's number one. So that's why even when we talk about concepts like resilience can be a double-edged sword. On the one hand, we want to talk about resilience and the capacity for an individual to bounce back. But for example, in our group, we study both internal resilience and external resilience. Because what is the external environment, the Canadian context that actually helps people thrive versus oppressing and keeping people down, right? So that's the external resilience we also need to be talking about. So, in this forum today, we talk about both internal and external resilience. I think both aspects we need to pay attention to. And then there is this, even psychologically, this mental health notion of who we are, the sense of belonging, that we're in this together, the internalized racism. And these are the multiple layers, right? Because from a mental health well-being kind of point of view, there's the stigma and racism, but unfortunately, there's also internalized racism that marginalized groups come to believe that they may be inferior, or, some of the Asian people I talked to, maybe we are to blame somehow. I don't know how. I didn't spread the virus, but, they have this internalized racism that kind of penetrates into it. And also with this, I also want to say that historically, a lot of this racism has already been in place, even for the Asian group, from the John A. Macdonald saying Chinese people should not vote because they are an inferior race. I don't know how many people know that, to the head tax. It's always been there. It's as highlighted now, as Asante is saying, just as now in the public consciousness. And also even for Asians, we're caught in this Asian model minority group. Like, you as a minority group, like, you better not speak up so much because you don't have it worse than maybe someplace else. That actually is another layer of guilt. Oh, we're a minority, but maybe we shouldn't complain so much. We don't have it worse. When we really need to, like Asante and Myrna and is saying, and Nathan is saying, we need to look at the diverse intersectionality of how all these marginalized, there's multiple layers where we're marginalized. Instead of pitting one against the other, it's more collectively, how do we respond together so that there is equity for all, right? So like my son has autism, and so I'm also all about the disabled community and how they're hit in this pandemic, and people are separated in their own group homes and not accessing to like their parents. And I support them, people with parents with children with autism, and also FASD, another neglected community. So examples goes on, and sexual orientation, and that gets marginalized. So these layers have multiple layers of inequities that we need to address, and we need to be able to face and to admit to these problems from systemic to the individual.
May I jump in? May I jump in here, Jane?
Please, Myrna, go right ahead.
Thank you. Ken, listening to Ken, I'm reminded of that movie, The Usual Suspects, where someone says in it, the best thing the devil did was to convince people that he didn't exist. And this is what we're dealing with when you're dealing with racism. And what happens is that people get pitted against each other for what I refer to as they force us into fighting for the supremacy of pain. I'm saying my life is worse than yours, and they do it a lot. It happened a lot between Black people and the Indigenous people. They force us into fighting each other to say, I'm in more pain. They put me on a ship. Now they stole my land. But we've got to not allow that to continue. And Ken referred to the social determinants of health. And of course, we all know that racism is one of the big ones. There's stress, there's cardiovascular disorders, there's addictions, but there's this, as Ken pointed out, there's this terrible internalization of inferiority, such that parents then pass on that in the intergenerational trauma into their children. And the very act of speaking and trying to protect your children with that, telling them about it, the parents then go through the trauma themselves again. So it's constantly being done. It's ridiculous that you have to say to a 7-year-old child, if you're going to the store and you buy a pack of gum, make sure you don't leave that store without the receipt. It's ridiculous. No one else has to say that to their children. I get followed around. I've been followed around in stores so often. I heard someone say, she's got a big purse, follow her. You go into a place, your skin is black, it's automatically assumed that you cannot be the bearer of knowledge. You know, you go into a classroom, I go into a classroom, so many students still say to me, you're the first Black prof I've ever had. And they're shocked. They're absolutely shocked because it's not assumed that this Black person can be the bearer of knowledge. We must be thieves, we must be suspect all the time. It's ridiculous. And I think that our Canadian brothers and sisters, as Asante pointed out a couple of weeks ago when we were on a panel together, somebody had to die for our white Canadian brothers and sisters to take us seriously when we told them, this is our life, this is what we live, it's painful, it's killing us, or it's messing with our mental health. And someone had to die for that to happen. We ought to be ashamed of ourselves about that. My hope is that now that it's being seen that people don't go back, that we've got a new president of the United States, I'm hoping that they don't say, oh, well, the old one's gone, so we can go back to being the way we were. We can call Muslims names. We can go after Asians. We can go after the indigenous people because it's smooth again. Barack Obama did not stop racism, folks. You know, if anything, his election opened the door to all those who were hiding behind the curtain. And I don't know how to get them back, but we have to do it together.
Absolutely. Hear, hear, Myrna. Thank you for that. I'm gonna jump over to Natan again to just kind of get his perspective. And you know, when we talk about determinants of health and its impact on mental wellness and racism, I know you talk a lot about rights too, and it's, you know, the roots of not just things, you know, housing and poverty and things like that, but the denial of rights. What are your thoughts about sort of the very long links between racism and mental health issues in Inuit territories?
Well, I'll start with suicide. You know, Inuit did not have an elevated rate of suicide in our communities before the 1970s. Suicide exists in every known society, so it isn't as if it was completely unknown. But you can't help but link the imposition of government control over our communities in a post-World War II sovereignty exercise combined with residential schools and dog slaughter in our communities and complete control over our education and economic well-being as anything other than a mental health catastrophe that then led to the elevated rates of suicide, which then have cascaded through generations that still remain unabated. That is a very large story, but we're still dealing with the consequences of colonization in action, especially when it comes to the recognition and implementation of our rights. The ability to self-determine as a people provides a level of support for mental health that just is undeniable. It doesn't solve all of our challenges. And we are going to need a mix of or Inuit specific mental health supports and clinical mental health supports to get us through to a better place. We want to provide all of the avenues towards this as possible, but recognizing these systems of government control as inherently racist and needing to then be anti-racist, be actively anti-racist in the way that we engage, the way that we work together between Inuit and government is really the only way that we can chart our course to a better future. There are so many ways that you can describe inequity and show inequity in action. And then there are, on the other side of this, government has so many ways to describe the way that it is impossible to act on inequity until it becomes a necessity and it happens. You look at the pandemic and you look at the Canadian government response. It's incredible the way Canada mobilized a response for CERB and for other supports in relation to the pandemic. It is possible. 2020 was also amazing in relation to the things that happened that I didn't know when they would happen, although I knew they would, especially when it comes to things like Indigenous mascots in sports and the changing of the name by Washington in the NFL and Cleveland in baseball and Edmonton in the CFL. These were always racist. These always had a negative mental health impact on a number of people within our community. That was never going to change. These things that have happened are amazing lurches forward, and they're not done yet. But for all of the awful things that we've been through in relation to racial injustice and the things that continue to happen, I am hopeful because of what was accomplished, no matter the dark side of it in 2020.
Wow, that's it's good to think of the positive lurches forward, but as Myrna said, never to think that we should we can't stop the progress on that's been made in that. Asante, what do you help us think through what in as plain a language as you can around how you see racism impacting the mental health of the people that you're working with? And maybe even if you have some specific examples of some of the folks you've worked with in terms of how racism impacts their well-being.
Yeah, I mean, even speaking from my own personal experience, every time I walk outside the door, I become vigilant. I become vigilant of what that person walking down the street is thinking of me. Are they going to call the police on me if I'm wearing a particular set of clothing? I grew up very much in hip hop. And so, sometimes when I walk out of the house, today I'm wearing the blazer and all that, but I dress differently in my day-to-day life, right? And so I have to worry about things like that. The other day, I was accosted by a woman for sitting in my car listening to music loud, in her neighborhood at 4 p.m. during the day. It's broad daylight outside, and she let me know that I wasn't supposed to be there. This happened maybe about 3 weeks ago. So these are the sorts of things that have deleterious effects on your mental health, because it's not a one-time thing. This is a thing that's been happening to me since I was a child. When I say child, I mean like kindergarten child. So, and it was since I was 5 or 6, where I remember the first time I went to daycare in Toronto, 4 years old, and I'm wondering why the Asian kids play with me, the Latino kids are playing with me, the Black kids are playing with me, but the white kids don't play with me. What is that about? And I didn't know what to call it back then, but I felt the impact of it. And then I would look around my world and I didn't see myself represented in any of it. As Dr. Lassie was saying before, in the entirety of my life, through, kindergarten to grade 12, undergrad, not one Black teacher or professor, zero in the entirety of my life. Not one Black doctor, any of these things, right? So racism shows up in a lot of ways in our society. And then, when you don't see yourselves in represented, it starts to tell you on a subconscious level that you do not belong. And then when you start to internalize that, even though you might walk around with bravado or something else, but that feeling of not belonging gets internalized, and again, has a deleterious effect on your mental health. And that's not even to speak of, the danger of being a Black male in society, where, I was growing up, my older brothers were beat up by white supremacists, and these guys lived in our building. So we reside in the same building. And then those guys would beat up my brothers, had younger brothers who would try to bully me. So this is like a real thing that is happening. So of course I had a lot of anxiety. Police don't necessarily protect me. I've been, called dangerous by police officers by, getting out of my car too quickly, literally, being stopped for that, and among so many other things, right? And this is just my own experience, not to speak of the experiences of my brothers, not to speak of the experiences of my friends or the youth that I work with, people who are, said that they're resisting arrest or being assaulted by police officers just for not, or just for standing in a place where the officer said they shouldn't be standing. So just the physical and psychological danger that we are in all the time, just accumulates. And, a lot of us, by the time we get to high school age, we come to this realization that the world that we're living in, the society that we're living in, does not want us to exist within it. It may want to take advantage of, certain talents that we might have when those talents emerge, but it doesn't really want us to be in the society, right? So then what happens with those young people is they start to, well, the society doesn't want me anyway, so I'm not going to try as hard to be a part of that society. And even when I do, I'm being streamed into, in Ontario, we have, academic and applied in our school system, academic being the university path and applied being the community college path. We're streamed into the community college path, or the, just get a high school diploma, locally developed path. So these things are happening too. So just on so many levels, the impacts of this discrimination, it tells us that we don't belong. So of course we have people who have a high level of anxiety. And of course we have people who have a high level of stress, which then leads to, those of us who work in mental health know that stress is a pretty big predictor of diagnosable mental health disorders. So yeah, of course these things are happening, like depression and schizophrenia and bipolar disorder and everything across the board. We're seeing greater and greater self-harm in our communities these days. So huge deleterious effects in terms of mental health when we talk about racism and discrimination. And this isn't one thing I also want to emphasize. A little bit earlier, we were talking about now racism is a conversation that we're having, and Nathaniel were talking about it. And one thing I want to highlight that I think you were alluding to as well, Nathaniel, is that this is not just our issue. It's an issue that impacts all of us, because if I have poor mental health and poor life outcomes, the likelihood that I'm going to be a quote unquote productive member of society is then diminished, which is going to have other impacts on, so in so many different ways. So it is up to all of us to solve this issue and to, not really look at racism as important, because I think a lot of people don't think it's important, but it's very important, especially as our world becomes more, as we communicate more across culture and nations and race and ethnicity and all these things, and we get closer together and the borders get broken down. We are living together now. So we got to figure this out, because if we're living together and we don't figure it out, then what's going to happen?
Well, thank you for being such a vocal, outspoken advocate for mental wellness, and all four of you have really played that role. And I want to just make sure everybody knows that think there are a bunch of resources that have been shared in the chat, and each of you have kind of referred to some resources. So we're going to make sure everybody gets a list of some of these resources. We'll share it out to anyone who's signed up for the webinar. But in the few minutes that remain, I kind of wanted to turn things into sort of some of you talked about action steps, or how can we, what positive steps can people who are listening today and those that they'll share this with, in terms of either supporting our own mental wellness for those who are struggling, or what can we do to reach out and provide support and strength to the people around us? What's your best advice? You got 1,000 people listening to you, and maybe thousands more that'll follow. What's your best advice to the audience? Let's see, who shall we go to first? Myrna?
Well, I'm a strong believer in focusing on the things over which you have control, and putting the things over which you don't have control aside. I know that I have control over whether or not I wear a mask. I know that I have control over my exercise. I know that I have control over what I eat. I know that I have control over what I allow to take over my life. I know my life is not easy. It's never going to get easy. And I don't want anyone to think that if you get to be a professor and you get to have the PhD, that you're still not seen as the Black person. That's what you get seen as first. You don't get seen as the academic or whatever it is. I get seen as a Black person first. So knowing that, I try to compartmentalize as much as I can, because I will not allow this to destroy me. I will not allow it. It causes me pain, but I will not allow it to destroy me. And I think we need to grab those things over which we have control and focus on those and hold on to those things, Derek. Hold on to your support system. Hold on to your family as much as you can. Use Zoom to set up ways where you can interact with others. Have movie night on Zoom, have dinners on Zoom, all of those things. Use Zoom as much as you can to maintain the routine of the life you had before the shutdown of the pandemic.
Thanks, Myrna, for that great words of wisdom. Ken, what are your words of wisdom for the audience on mental wellness?
I think that it begins with a shift in awareness and attitudes and conversation. So something like this forum, and just, I know we can't reply to all the people who send in questions, and I think there's so many thoughtful things. So I think dialogue, acknowledging that this exists, this racism exists, is important, and not to, as Myrna is saying, let people hide behind the curtains. And a shift in attitudes, because I remember doing like a cultural commons consultation on an institution, and one of the respondents says, why go through all this trouble when there's only one person complaining, like they don't have language access or something like this? So instead of saying that, well, let's go for the majority and not waste resources on the one, we have to acknowledge that, but what if that one person is your mother? Right. So it is like we need to acknowledge that shift in attitude, that we are part of the same fabric, the same community, rather than dividing. And I think that also addressing this issue, people are also reluctant to label, obviously, themselves as racist or other people as racist. And then we have this polite conversation that racism occurs south of the border, which of course isn't true. So I think that we are all in this together, and a lot of labels are destructive. And even we want to label racism as an act, but not people as racist, because that actually, like, nobody would say, oh, there isn't a racist in Canada. Like, who is racist? And nobody raised their hand in Canada, right? So I think that we need to have that compassionate lens, and so that it can really face and acknowledge, yes, these things exist. We all have biases, and they can affect it. And then the knowledge piece. The knowledge piece is to acknowledge that our science, we preview certain kind of knowledge, like we talk about the importance of cultural knowledge, indigenous knowledge, versus scientific knowledge that's based on weird science. As some of you might know the term weird. Weird science. Weird stands for Western, educated, industrialized, rich, and democratic countries. Okay, all our scientific research, vast majority of everything that we do and say that's the norm, this is the best care, is based on weird research. And that's been acknowledged from a scientific point of view. So from a scientific, knowledge-based evidence point of view, we need to move beyond weird science and towards really acknowledging that not only is this instrumental for us survival together as a family, but also there's just so much to gain from diversity, because we want to know that diversity is a strength. And then we need to acknowledge that. And finally, there's empowerment. So empowerment is an important thing, as Nathan is talking about. We need to empower each individual. In other words, the solution also, again, does not come from only a minority knowledge privileged people. We need to basically share the power, and that piece, like sharing the power and knowing that solutions can also come from the diverse communities. Not only are they always the victim and be a token voice, but allow the diverse community be the leaders, be the people in charge, a part of that solution, so that we can work towards a solution together.
Thank you, Ken. That's great. And people are asking if you can repeat the weird acronym. So I'll get you to do that quickly before I go to Nathan.
Western, educated, industrialized, rich, democratic. So these are the kind of the loudest voices in science that says this is knowledge, this is the truth.
Okay. So Nathan, you've always got good words of wisdom. What do you want us to remember from our conversation?
You know, it's interesting. We as individuals all have our own journeys, especially with mental health. And often there are unrealistic ideas about how strong each one of us are in relation to the work that we do or how we stay strong. And I saw some of that in the comments. But really, I think for me, it's encouraging people to keep putting one step in front of the other on the path that you're making for your own mental health, but then also the change that you want to see, whether it's for racial injustice or whether it's for your own community or whether it's any of the interests that you might have that you want to see changes in the world. Don't get discouraged, but inaction will then inevitably lead to the realization of the concerns or the worries. And I think part of that too is in relation to ourselves. We can get stuck sometimes in feeling the inertia of not knowing how to move forward. But there are help. There is help. There are people that you can talk to, and start with those that you love and those that love you, and also those that have supported you. Many times it's just this, I don't necessarily have the answers. I'm not a mental health specialist, but often I can recommend a place to go. I can recommend a line to call. I can recommend another loved one that cares deeply and maybe gives a deeper insight. So just on the personal level, I just encourage people to, sometimes it's so courageous just to take that next step that is going to be difficult, but really will lead to better mental health.
Thanks very much, Nathan. And Asante, we're going to give you the last words of wisdom opportunity to share with the audience. What, how can they stay strong?
That's a big question. You put me on the spot. No, it's okay. I think in many ways I want to echo the sentiments of everyone who has spoken before me. But I'm a big believer in stories, and I'm a big believer in community. And I think that in a lot of ways we are socialized to tell half stories to the people around us and not the whole story. And what really I think facilitates connection and community is telling our stories, and also listening to the stories of others. If I share my experience and that experience is received well and received with compassion, then you share your experience and I receive your experience with compassion. Now we have a connection. Now we have intimacy. And with trust and intimacy is where healing begins and healing happens, right? So for me, it's about, finding those people in your life who you can, feel safe sharing your experience with. I understand that it's not going to be everybody, but there are people. And if there aren't people yet, one of the beautiful things about living in 2021 is how we can connect, through things like the internet and social media, and find others who are like ourselves, find others who have stories like ourselves, with which to connect. So for me, it's all about reaching out and connecting with those around you, and really acknowledging the community that you have around you. And I think the pandemic is a huge opportunity for that, as we live these very busy lives and everyone's on the grind and everyone is trying to figure out their career and pay the bills and all of these pieces. But let's not forget the people that we have in our lives, and the joy that we can derive from those people. And as I talk about joy, just trying to find joy in small everyday things. In the industry I work, we talk about self-care all the time. And sometimes self-care becomes this conversation of, you must do something that you're not currently doing to engage in self-care. But many of us are doing things to engage in self-care. We just do not necessarily recognize it as that, because it's not a spin cycle class, and it's not yoga, and it's not deep breathing and meditation. Maybe your self-care is binge watching Bridgerton on Netflix. Maybe your self-care is, for me, one of the things I do is I very often watch basketball while talking to my brother because we're big sports people in my family. And so that's like my self-care. And people say, oh, you're wasting your time watching these men run around and throw a ball in the basket. But if that's what brings us joy, why not engage in that? So it's going to be different for everyone. Let's look inside of ourselves and find, where we get joy in ways that, of course, don't have, negative health impacts or life impacts. But then also let's look at those around us and the community that we have, and reach out to them as well, and be brave enough to, tell our stories and be compassionate enough to receive other stories as well.
Can I just also add to what Asante is saying? I think when he mentioned self-care and also the importance of community, I think it's so important, like what Asante is saying, to link those two together. Because right now we always talk about resilience and self-care, except self. It's not just individual self, it's we. It becomes, self-care becomes we care. So we're one happy family.
That's great. Well, you know what? We have run out of time. I am so delighted to have been able to spend this time with the four of you. You're all exceptional people who give of yourselves every single day to make the world safer and healthier. And I thank you for being brave, for being compassionate, for speaking out. I want to thank Bell Let's Talk for deciding to do this event, and encourage everybody to keep the conversation going. Next week on the 28th is Bell Let's Talk Day, so more time to speak about how we can care for one another. And I want to thank Queen's University for their willingness to host the event. And everybody's going to get some outreach. All those of you who have signed up to the webinar, you'll have a follow-up, just providing some of the resources that have been shared. And go out and take care of one another and take care of your people and those around you. Have a wonderful day.
Thank you very much.
Thank you, everyone.
Goodbye, everyone.